Bangladesh, known to the world as the Queen of Beauty. This beautiful flag bears the story of limitless sacrifices.
এবারে সংগ্রাম আমাদের মুক্তির সংগ্রাম এবারে সংগ্রাম স্বাধীনতার সংগ্রাম
Millions of deaths, unimaginable sufferings and sacrifices made the dream come true. The war of 1971 made a country and a nation who promised never to bow down. Since its independence, Bangladesh has flourished herself and has made a remarkable progress in education, women empowerment, infrastructure, health and hygiene, human rights, democracy, and so many ways aligned with the world. Bangladesh has achieved remarkably in the Millennium Development Goals in terms of poverty reduction, attaining gender parity at primary and secondary education, under 5 mortality rate reduction, reducing the prevalence of underweight children, lowering maternal mortality ratio, improving immunization coverage, water sanitation coverage, and reducing the incidence of communicable diseases.
We all know that Bangladesh has achieved historic progress in achieving almost zero open defecation and made good progress towards the target of the Millennium Development Goals. Because of such improvements, the casualty from etheric disease has fallen rapidly. We know in Agenda 2030, the Sustainable Development Goal 6 aims to tackle challenges related to drinking water, sanitation and hygiene for the population as well as to water-related ecosystems. We have to focus on equality, sustainable water resource and sanitation, and with a view to having solid progress in many other areas across the SDGs, including health, education, and poverty reduction.
And it became one of the promising countries towards attaining sustainable development goals to end poverty, protect the planet, reduce gender gap, mitigating climate and disaster risk, ensuring safe water and sanitation for all, and confirming that all people enjoy peace and prosperity by 2030. Bangladesh is already showing its commitment towards SDG 6, water and sanitation for all. Bangladesh has achieved an outstanding growth. Already, the country has attained almost zero open defecation, which is a remarkable success of sanitation. In 2019, 84.6% of household members were using improved sanitation facilities and 74.8% of households reported practicing a hand-washing facility with soap and water, and the number is rising even among the poorest of the poor. Bangladesh is one of the members of the high-level panel on water convened by the UN and the World Bank.
We need to take action for proper management of the freshwater ecosystems and access to the safely managed sanitation. Those are essential to the human health, environmental sustainability, and the economic prosperity. We need to sustain the success we have achieved in the safe water and sanitation sector and the role of all concerned in the tackling and existing challenges and turn our acquired experience into the social movement.
Despite these accomplishments, it would be a big challenge to achieve SDG 6 if we can't manage the fecal sludge with a coordinated approach. To achieve SDG 6, the government of Bangladesh is bringing all actors in a row. Coordination development partners and incorporation of FSM in different sanitation and development projects are reflecting the government's commitment towards achieving the SDG Target 6.2. Utilization of modern technology for FSM, capacity building of stakeholders, and financing for FSM business are some of the key actions but the government is working with partners. Still, there is a long way for this journey. Overcoming the financial and technological challenges, engaging and influencing decision makers at different stages are some of the challenges that need to be addressed rigorously. And each and everyone who has a stake in the sector should work together to attain the goals. To overcome these challenges, a sectoral commitment with the GO-NGO collaboration named FSM Network has been established. The FSM Network is a platform that is working to make this impossible to I am possible. To plan and implement a proper action to achieve SDGs, its demand for guidance on how best to establish supportive, enabling environment for sanitation through strong policies, plans and legal frameworks. As a result of the coordinated effort between the government and FSM actors, the institutional and regulatory framework IRF has been adopted in 2017 with the central notion of ensuring safe sanitation service in Bangladesh aligned with SDG Target 6.2. The government has also adopted the principle of mechanical emptying of pits and toilets nationally, considering health and safety of sanitation workers. The National Action Plan NAP for implementing IRF FSM in the municipalities has also been approved and adopted by the government for FSM in 2020. To ensure effective FSM following a sustainable approach, a CWIS FSM support cell has been established in DPHE under the Local Government Division. The cell is supported by Bill and Melinda Gates Foundation.
We all know that the SDG target is to achieve the safely managed sanitation countrywide. There are challenges of identifying appropriate indicators of safely managed sanitation in Bangladesh. Also, it is important for the country to improve containment as well as entire sanitation chain, not only having toilets. In parallel, solid waste management needs to improve for overall environmental sanitation. CWIS FSM support cell will work closely with relevant sector actors on this. There are more than 100 municipalities where fecal sludge treatment plant will be constructed within 2 to 3 years and under different projects of Department of Public Health, Engineering and many more.
We are triggering to develop the CWIS ecosystem in Bangladesh under the leadership of the government so that we can work collaboratively with the government, NGOs, INGOs, sector partners, private sectors all together and to achieve the equitable sanitation service for all. And CWIS FSM support cell is now providing the technical support to this government so that we shall have the journey together. Our primary task is number one, to have the coordination with all the sector partners so that we will have our journey together of this sanitation and safely managed sanitation. Number two is that we need to develop the capacity of the sector and for which CWIS FSM support cell together with IT and GUET is working to develop the capacity of all the Poroshobhas of the country gradually. Number three is the technical solutions is very much important. What treatment technologies are required to reach the SDG 6.2 target? There are a number of innovative technologies as like omniprocessor, biodigester, reinvented toilet, and we need to create the market for these technologies to reach the SDG 6.2. And finally, the dashboard for the data monitoring system is very much important because there is a lack of data of this SDG 6.2 right at this moment in Bangladesh, and we are developing the national dashboard for monitoring SDG 6.2 so that we can get the data of the Poroshobhas or municipalities in the country. And the last one is very acute as we are doing the advocacy with the International Finance Institute, where we are supporting the government for further investment in sanitation journey, so that we will have our journey together in the ecosystem.
Developing CWIS ecosystem is another major achievement of the FSM sector to ensure a sustainable solution of sanitation for all. During the COVID-19 pandemic, the importance of public health has been realized more than ever. The safe management of fecal sludge is one of the key elements to keep the country healthy and safe. The government is prioritizing the safety and health of the Bangladeshi people by ensuring safe sanitation for all.
Bangladesh is a growing country, and our beside this pandemic situation, we are also facing all these challenges very seriously, and we hope sooner or later antidote will come, and the world will get chance to escape from this case of pandemic, and same in Bangladesh. But one of the big advantages in Bangladesh, under the leadership of our Honorable Prime Minister, is unified. All the peoples of Bangladesh are very much optimistic to work under the leadership of Honorable Prime Minister. So this is why whatever the effect it had about the pandemic, then country after completion after the end of this pandemic, then Bangladesh could rescue this whatever the situation facing nowadays. It will be rescued very successfully. So I believe that the development partners, those who are working with us, and we all together work for these kinds of a solid waste and fecal sludge management, and as well as all other issue whatever is required, they will with us. In Bangladesh, I think in South Asia could be exemplary country about many issues, including the city inclusive sanitation.
Our promise is to work together collaboratively to achieve safely managed sanitation service nationally.